Which you find is most appropriate initial diagnostic test? All right, let's see. 25-year-old woman is brought to the ED after experiencing a seizure lasting approximately 2 minutes. According to witnesses, she initially had a period of muscle stiffening followed by rhythmic jerking of her extremities. After the seizure, she was confused, disoriented. No prior history of seizures, which you find is the most appropriate diagnostic test. Okay. I was going over something last night. I know it's a side thing, but the diagnostic test gold standard for MS is MRI. And I know this is not asking that, but I just wanted to tie it in because I'm like, okay, they're not asking about MS. So to me, seizure just screams the like EEG.
Okay.
I'm trying to think of why it wouldn't be that. I'm pretty sure with an EEG you can see like what type of seizure it is, and it'll look at like the different waveforms and to determine that in like neurology. Um, it's not a PET scan, like I said, MRI, the gold standard thing. If they were talking about like an MS patient, I learned that last night. I thought it was CT. It's not. CT's for like bleeding or any bleeding or kidney or GI. I'm thinking lumbar puncture, not really. That's for looking for like they ask a lot of like what's that called? Meningitis
Okay.
question. So yeah, I'd go with the EEG.
Okay.
Oh,
So
okay.
this is kind of
CT.
interesting here. EEG. Okay. For one, let me just kind of say this. I always say this for these questions, but not really. Step one kosher here, right? Most appropriate initial, right, is always going to be a
Mm-hmm.
two question. EEG is good for confirming seizure. Okay, but
Okay.
her symptoms are already pretty much confirming
So
that
we
she.
know it's a seizure, so we don't need to confirm. Okay.
Exactly, right? So
Okay.
then the question is, why is she having a seizure, right? So in my mind, I'm thinking initially, like, does she have, a mass, right? What is one of the things
Okay.
initially that you can find out, right? So non-contrast CT, right? So you can have any
Oh, it's to
intracranial
rule out
abnormality,
hemorrhage.
yeah,
Okay.
hemorrhage, mass, and infarction, right?
Okay.
EEG, like I said, is diagnosing epilepsy or seizure, which, for her.
That's what I thought. That's what I was like thinking about.
Yep.
But
MRI,
okay.
right, is better for structural anomalies, but it's more expensive, right? Takes a longer time. So you want to start with the
Mm-hmm.
CT, is going to give you some information. Lumbar puncture, you hit it right in the nail here, meningitis or encephalitis, right? Because
Mm-hmm.
you can get the CSF, see if there's any kind of increased leukocytes or
Yeah,
glial
or
cells.
opening pressure. They always mention. I went over some of
Exactly.
that stuff last night.
Yep.
In terms of like different, like it's ecovirus,
Exactly.
and like stuff like that. I'm like, okay, those are like very small details that they tend to
Yep.
pop up though. So
Then PET scan is usually for cancers, right? Like,
okay,
but so not going to be the case here. Yeah. So best answer is going to be CT scan here,
okay,
but this is not really quote unquote fair for step two,
okay.
but you're on the right track for sure.